Hi everyone, so today I will be talking about the superficial front line in the anatomy train. Starting off with some of the muscles in the anatomy train of the superficial front line include the tibialis anterior, the extensor digitorum longus, the extensor hallucis longus, the peroneus tertius, the patellar tendon, the quadriceps tendon, the rectus femoris, the vastus lateralis, vastus medialis, vastus intermedius, the rectus abdominis, the sternal fascia, the sternocleidomastoid, and the platysma. So this is just a diagram of what the superficial front line muscles look like. So as you can see, they start at the top of the foot, go up into the lower front leg, up into the rectus femoris and the hip flexors, up into the rectus abdominis, into that sternum and chest wall, and up into the neck and the bottom of the head. So getting into what these muscles do, the tibialis anterior does dorsiflexion at the ankle and inverts the foot. The extensor digitorum longus extends digits 2 through 5, dorsiflexion and eversion. The extensor hallucis longus extends just digit 1, which is also known as the big toe. The peroneus tertius does dorsiflexion and eversion. Your patellar tendon helps with knee extension. The quadriceps tendon connects the quad muscles down to the patella, and the rectus femoris does hip flexion and knee extension. So the vastus lateralis also does knee extension, vastus medialis does knee extension, and the vastus intermedius also does knee extension. Your rectus abdominis does trunk flexion. The sternal fascia is going to stabilize your chest wall. The sternocleidomastoid does opposite side rotation and ipsilateral flexion and lateral flexion. And lastly, the platysma is going to tense the neck and depress the mandible. So what is the role of the superficial front line? It creates flexion of the trunk and hips, extension of the knee, and dorsiflexion of the foot. It's going to connect the entire anterior surface of the body from the top of the feet to the top of the head, just like we saw in that diagram from earlier. And the superficial front line is going to be divided into two sections. So the first section is from your toes to your pelvis, and that second section is going to be from your pelvis to the head. So, for example, when you are standing or walking, the superficial front line is going to act as one continuous line. However, when you are bent over or you are sitting, these two sections are going to function separately. And lastly, it's going to provide balance and prevent excessive backward arching, which is also known as hyperlordosis. So some assessments that we can see in a static assessment in the superficial front line would be static assessments, which in this we could see any type of quadricep imbalance, any knee valgus or varus. We can see rounded shoulders. We can see an imbalance in your hips if one is higher than the other. And we can also see if you are overpronating or oversupinating your feet. Next, going into the overhead squat assessment, this is where your hands go straight over your head. And if your hands fall forward, this is going to indicate that you have tight chest muscles like your pec major and minor. If that occurs, we can go into the modified overhead squat, which is either your hands on your hips and squatting, or you can elevate the back of your heels on a upper surface. Next, we can do single leg squats, which is just standing on one leg and having your hands on your hips and squatting down on that one leg. And we can also see this in mobility assessments and the modified Thomas test, which is the image on this slide. So what you basically do is you scooch your butt to the bottom of the bench and you will be testing to see if you have tight quads, and we can see this in the leg that is just laying on the table. So some exercises to strengthen the superficial front line include a kneeling hip flexor stretch in a static position, a kneeling hip flexor stretch in a standing position, foam rolling your hip flexors, doing a quad stretch, a cat-cow stretch, which is also the picture on this slide as you can see, the cobra pose, stability ball extension, chin tucks, and the sternocleidomastoid stretch. Some exercises to strengthen the superficial front line include dead bugs, planks, reverse lunge, split squats, step-ups, and bear crawls. And bear crawls, you can see how to do these correctly in this image in the bottom left corner. And all of these exercises, you can really see if there's any imbalances with overactive or underactive muscles, and those can be corrected before even moving on from these ones. So some common dysfunctions in the superficial front line, like I said, you can see an anterior head carriage, which is having your head tilted forward, your rounded shoulders, rib flaring, anterior pelvic tilt, imbalance in quads, decreased hip extension, and you can especially see this during gait patterns, excessive lumbar extension, trunk instability, and knee valgus and varus. So these are some pictures. So the top left picture, you can see what normal knees should look like. The middle picture is indicating varus knees, which is when they go outwards, and the valgus knees is the opposite, when they go inwards. In the bottom left picture, you can see that anterior head carriage where your chin kind of sticks out a little bit more. In the top right picture, this is going to indicate trunk instability. And then in the bottom right picture, you can see on the right side, it's what your spine should normally look like. And in the right side, that's hyperkyphosis and also a little bit of hyperlordosis. So some activities that use the superficial front line includes running, walking, standing, jumping, soccer, boxing, and a lot of other sports use the superficial front line like gymnastics, basketball, baseball. Any of those will indicate the superficial front line in activities. So some biomechanical forces in the superficial front line include postural tension, which is going to prevent the body from falling backwards. So it's kind of just that base of support. For movement, like I said, it does flexion of the trunk, flexion of the hips, extension of the knees, and dorsiflexion at the foot. And the superficial front line is constantly working with the superficial back line in certain positions, and the superficial front line will contract to maintain balance, and vice versa. So some common injuries that we can see in the superficial front line is a lot of knee pain, which is also known as patellofemoral pain, hip flexor strains like an anterior pelvic tilt, neck strains, which can be chronically tight sternocleidomastoid and your pec muscles. So you really want to focus on inhibiting those overactive pec muscles and activating the correct muscles. Then we can see postural strains, and at the foot and ankle, you can see plantar fasciitis. And all of these common injuries, they can also indicate pain starting from other areas, not just from the knee. So if it's knee pain, that could also be something in your hip or in your lower leg. So as you can see here, so the top left picture, that's patellofemoral pain. So you can see that the bone is rubbing on bone, which is very painful. The bottom left picture is going to indicate that anterior pelvic tilt, which is also going to create hyperlordosis in your back, creating that back pain. The middle picture is how your posture should be. So we have the correct posture, if you have a hollow back, a flat pelvis, slumping posture, a military posture, or if you have rounded shoulders. And these can cause a lot of imbalances in your back going down into your legs. So the top picture in the right side indicates the plantar fasciitis pain, and the bottom right picture is that neck pain, which can be muscle strains, herniated discs, or even arthritis. So some key takeaways from the superficial front line is that it's going to act as a postural counterbalance to the superficial back line. It helps you stand upright, lifts against gravity. It's going to initiate forward movement, and tightness in this line will often pull the posture forward, which is going to create hunched shoulders and a forward head posture like we talked about. And it's going to protect vulnerable visceral organs and plays a major role in the body's startle reflex. And those are my references.